Hi, I'm Dr. Joe Niamtu, LoveThatFace.com. If you follow our YouTube channel, you know that we do a lot of work with osteoma removal, and specifically endoscopic removal. So by using the endoscope, it's the same technology that's used in shoulder surgery and knee surgery, and we make little hidden incisions up behind the hairline, and then we're able to get down and smooth these little bumps on the skull. So an osteoma is a little knuckle of bone, usually around the size of a knuckle. It can be from trauma, or they can just occur spontaneously. And so we're going to walk you through a little case of endoscopic removal of osteoma. So when treating osteomas, we always get a CT scan to see the actual size of the osteoma, and you can see that this is about the size of a marble, so it's actually pretty small. But what we also want to see, and we can change these views and actually look down in the skull, we want to make sure that this is, first of all, only a benign lesion, and it doesn't perforate into the skull towards the brain. So the CT scan gives us the ability to examine the interior of the skull and the associated structures, and that way we can look at the osteoma and we can see that there's no perforation. It's all on the outer table of bone. So this is a helpful tool, and again, most of these are usually benign and they're usually consistent with this type of situation. So what we're going to do is we're going to be making two little incisions in your hairline, probably one right there and one right here. So they'll be invisible. You won't actually see them. And this is a small osteoma when you're looking at it in the camera, but when you feel it and when you look at it on the CT, it's actually a little bigger. So we're going to be putting those scopes in through the hairline, and then we're going to be doing our actual visualization and shaving this. So, you know, it should take about 25 minutes, and we're going to sedate you because I think you'll be more comfortable. And when you wake up, there'll be dissolvable stitches there, and you can be on your way.
All right, I'm
Very
ready
good.
to do it.
Thank you, thank you. This is the endoscopic equipment, and one of the instruments is the camera and the other is the working instrument. And this is what we see when we look inside. This is the forehead or the frontal bone, and this is a larger osteoma in this particular image. This one is about half as big, or almost the size of a marble, and we're just using the instrument to point out the osteoma. We've already separated the periosteum from that. Now we're going to take this instrument called a sucker shaver. This is the same thing used in knee surgery or shoulder surgery, and this allows us to actually grind down this osteoma. I have the water turned off for a second in this video. Now we turn the water on. And so we use that instrument, and then after we grind this down, we use a smaller, finer instrument to shape this, and it has to be smooth. And we just run this back and forth. And again, I have the water turned off for this particular view. And then finally, at the end, the large lump is gone, and you have a smooth forehead. And then we'll take even a finer instrument called a rasp, and we will smooth that down so you can't feel it at all. So here we are with our patient after our endoscopic osteoma removal. She'll wear this little bandage overnight and then won't have to wear anything. And we finished, I'd say, 10 minutes ago. So how are you feeling?
I'm a little groggy right now, but I don't have any pain.
Good, good. Well, your osteoma's gone. Do you remember anything?
I do not remember a thing.
Okay, well, the osteoma's gone. She's not feeling any pain. She doesn't remember a thing. That's the great part about our 24-hour appointment after our endoscopic osteoma removal. How are we feeling?
Feel great.
You ready to get back in the car and drive home?
Or the motorcycle, yes.
That's right. This is my first osteoma patient with a motorcycle. So let's zoom in here, and basically the patient just wears a headband for a day or two, and you can see where the osteoma was here. It's nice and flat. Did you feel it?
I felt that was gone.
Yeah, that's what we want. And the incisions, they're hard to see, but they're right here. Those are flesh-colored dissolvable stitches, and so those will go away here in the next couple days. And this is how we do it. I hope you enjoyed our video. This is Dr. Joe Niamtu, LoveThatFace.com.